Okay, this brings us to the conjunctiva. This is a transparent mucous membrane that produces lubricating mucus secretion there. Palpebral conjunctiva is the membrane that lines the underside of the eyelids versus the bulbar conjunctiva, which is a membrane that covers the whites of the eyes. This is not the cornea, this is the conjunctiva. Small blood vessels are found in this membrane, and it's easily seen in bloodshot eyes or in conjunctivitis. The conjunctival sac is a space between the palpebral and bulbar conjunctiva. Okay. Lacrimal apparatus. This is the apparatus that the ducts and glands that drain tears into the nasal cavity. The lacrimal gland is located in the orbit above the lateral end of the eye that secretes a lacrimal secretion, or known as tears, a dilute saline solution containing mucus antibodies and antibacterial lysozymes that protects, from infections and other pathogens and just dust and just crap in general. Blinking spreads tears toward the medial commissure, where they enter paired lacrimal canaliculi via the lacrimal puncta. We'll see a little bit more in the pictures later. The lacrimal apparatus, the tears then drain into the lacrimal sac and the nasal lacrimal duct, which empties into the nasal cavity. So this picture here, you see this, the gland actually secretes through here, the excretory ducts. And then when you blink, the tears make their way towards the medial the medial portion of the eye. And this picture is actually pretty important. Extrinsic eye muscles. So these eye muscles are going to be what moves the eye around. There's 6 strap-like extrinsic muscles of the eye. They originate from the bony orbit and insert on the eyeball itself. They enable the eye to follow moving objects, maintaining shape of the eyeball and to hold it inside the orbit itself. There are 4 square-shaped ones called the rectus muscles. They originate from the common tendinous, posteriorly speaking, the tendinous ring. The names indicate which way the eye will move. So superior rectus is going to move the eye superiorly. Inferior rectus moves it inferiorly. Lateral rectus moves the eye laterally, and the medial rectus obviously moves the eye medially. 2 oblique muscles move the eye in the vertical plane and rotate the eyeball as well. So there's the superior and inferior oblique muscles. This is a picture just to show you what's going on here. So we have the straight muscles this way, and then you have the oblique muscles that come in diagonally. This picture is a good one. I'm glad I put the star there. Let's do this. I'm going to put a copy. We're going to start putting them on. Okay, for you table people, this is a good table. You can make a screenshot of it if you want to. If you want to know what slide number this is slide number 18. Okay, conjunctivitis then is going to be the inflammation of the conjunctiva resulting in reddened, irritated eyes. Pink eye is conjunctival infection. So it's highly contagious because, we talked about children and daycare centers and how cesspool-y they are, and they like to put their hands in their mouths and rub their eyeballs and touch other people, You know how that goes. Nasal cavity mucosa is continuous with the mucosa of the lacrimal duct system, so a cold or nasal inflammation often causes lacrimal mucosa to swell as well. So this is why you get the watery eyes, because the swelling will end up constricting the duct and it prevents the tears from draining. Diplopia is a word for double vision. Occurs when movements of external muscles of the 2 eyes are not perfectly coordinated. So a person can't properly focus on an image, so then you see 2 images instead of 1. So you're getting both the images from both eyes separately coming in at the same time. This can result from paralysis, extrinsic muscle weakness, or neurological disorders. Strabismus is when you get cross-eyed. It's a congenital weakness of the external eye muscles. So it rotates medially or laterally. So basically, if your right eye had a weaker lateral rectus muscle, then the eye would kind of be slightly turned out laterally because it's not, or if it's weaker, start over. if your lateral rectus muscle was weaker than the medial rectus was, then your eye would be turned in medially, because the medial rectus is going to be pulling harder than the lateral one to hold everything into place. This may alternate focusing on eyes may alternate focusing on objects, or only controllable eye is used. So the brain begins to disregard inputs from the deviate eye, which can become functionally blind if it's not treated early. Use it or lose it, right? Structures of the eyeball. I really like this one. Let's put another star there. Let's see, there's a couple of stars that we really like. This is a good one. The reason why this is really good, the reason why this is a really good one is because I'm moving stuff all over the place. The reason why it's good is because it allows you to see what cranial nerves are involved. Okay, we're gonna call that one good. I'm not going to fidget with it too many more times. Okay, so the wall of the eyeball contains 3 layers from the outside in. You got the fibrous layer, the vascular layer, and the inner layer. What's interesting is that the fibrous layer is called the scleral layer, and then the vascular layer is the choroid layer, and the inner layer is the retinal layer. Internal cavity is filled with fluids called humors. At one point, all fluids in the body in history were called humors. And remnants of that the terminology is still there. When we talk about humoral immunity, it means immunity that has to do with your blood. Lens separates the internal cavity into the anterior and posterior segments. Internal cavity, into anterior and posterior segments. This is important to know. This one, if I could put all kinds of different stars on here, I would. Let's move this around just a touch. Yep. Okay, that's pretty. Okay, so a couple things you should know about all of this is the posterior segment and the anterior segment, and how the anterior segment is then divided into the anterior and posterior chambers. We're going to go over this quite extensively when we get to the lecture, but the eye is actually divided into the anterior and posterior segments, or cavities. So the posterior, it's separated by that lens there. Okay, so this whole area is filled with vitreous humor versus the anterior segment, which is filled with the aqueous humor. Then the anterior segment is divided into the anterior and posterior chambers, which is what we're going to be talking about in just a little bit. Looking at the fibrous layer, the outermost layer, the dense avascular connective tissue, there's this sclera and cornea in the fibrous layer. Number 1, sclera is going to be the opaque posterior region. It protects and shapes the eyeball. It anchors the extrinsic eye muscles. And posteriorly, where the optic nerve exits, the sclera is continuous with the dura mater of the brain. So it's really sturdy. Cornea, that's important. I really like this slide. Okay, next. Cornea is the transparent anterior 1/6 of the fibrous layer. It forms clear window that lets light enter and bends the light as it enters the eye. The epithelium covers both surfaces. Outer surface protects from abrasions, although we still have corneal abrasions, don't we? But it's much better than having any of the other ones, other structures underneath it get damaged. Epithelium covers both surfaces. Outer surface protects from abrasions, and the inner layer, the corneal endothelium, contains sodium pumps that help maintain clarity of the cornea. Numerous pain receptors contribute to blinking and tearing reflexes. Okay. Good. The vascular layer, the middle pigmented layer of the eye, it's also called the uvea. There's three regions of the uvea, and there's the choroid, ciliary body, and the iris. The choroid region is the posterior portion of the uvea, supplies blood to all layers of the eyeball, and the brown pigment absorbs the light and prevents scattering of the light, which would cause visual confusion. Ciliary body. Anteriorly, the choroid becomes the ciliary body. It's a thickened ring of tissue surrounding the lens. It consists of the small, smooth muscle bundles called ciliary muscles that control the shape of the lens. The more it contracts, the flatter it gets, and the more it relaxes, the more biconvex it gets. Capillaries of the ciliary process secrete fluid for the anterior segment of the eyeball. The ciliary zonula, or the suspensory ligaments, it's more commonly known as, extends from the ciliary process to the lens, which holds it in position. The reason why suspensory ligament is much easier to remember is because it's exactly what it's doing for the lens, right? Suspensory means to hold it up. Ligament, everybody kind of associates with a soft tissue or like a attachment that attaches to a muscle. The iris is the colored part of the eye that lies between the cornea and the lens, continuous with the ciliary body. The pupil is a central opening. It's actually a hole, it's not a thing, that regulates the amount of light entering the eye. Close vision and bright light cause the sphincter pupillae, the circulatory muscles, to contract and have the pupils contract, and that's under parasympathetic control. Distant vision and dim light cause the dilator pupillae, which are radial muscles, to contract, which then the pupils will dilate. That's under sympathetic control, and it makes sense that the distant vision is under sympathetic control because sympathetic, as you recall, it does fight or flight responses, right? Fight or flight. And parasympathetic is rest and digest. So when you need to, when you need to run away from a bear, so to speak, you're gonna want to know where you need to be, and you need to let as much light and clarity. You need to be able to see. Everything needs to be open, and you have to be ready to go. Irises also change in emotional states. Pupils dilate and when subject matter is appealing or requires problem-solving skills. Is that interesting? So there you have it. Picture people. We should probably do this. I didn't want that. How do we? Okay. Inner layer is the retina. The retina originates as an outpocketing of the brain. It contains millions of photoreceptor cells that transduce light energy. There's neurons there and glial cells. Of course, when there's neuron cells, there's also going to be glial cells for support. It's a delicate two-layered membrane. There's an outer pigmented layer and an inner neural layer. What's interesting is that pathway of light there. Please pay attention where it actually goes and where it actually hits, right? There's a small area, and it's not shown here, but that actual point of where the light hits the most is not this portion here. This optic disc is actually where your blind spot is located, because this is where all the cords come out. You actually don't have any photoreceptors here. All of your photoreceptors are going to be right where the point of path of light hits the back of the retina. That little area is actually called the macula. Okay, so there's like a little dimple in the middle of that macular region. And that's where, so the macula has the highest concentration of rods and cones, which are all the photoreceptors. And we'll talk about what rods and cones do specifically towards a little later, I believe, in the slides. But there, in the center of the macula, there's going to be a little dimple. And I don't know if you remember from learning about bones, fovea, right? Fovea means little dimple. Fovea centralis, so that means a centralized or middle dimple. That area is actually the point of highest acuity of vision, and the highest number of photoreceptors that deal with color, which are actually called cones. The other ones that deal with dim light and black and white vision are going to be called rods. Okay. The inner layer of the retina is the pigmented layer of the retina. So when we talk about the inner layer, which is the retina, we're going to talk about the pigmented layer of the retina, which is a single cell thick lining next to the choroid. And of course, the choroid is heavily pigmented. Oh. Okay. So you have the single cell thick lining next to the choroid, and it extends anteriorly, covering the ciliary body and the iris. The function is to absorb the light and prevent scattering of the light, and it phagocytizes photoreceptor cell fragments. If there's little fragments, it kind of cleans everything up, and it also stores vitamin A. This is why vitamin A being beneficial for your eyes is very important. The vitamin A derivative that actually directly deals with light sensitivity and being able to see is called rhodopsin. The inner layer of the retina is called the neural layer, and it's a transparent layer that runs anteriorly to the margin of the ciliary body. The anterior end has serrated edges called the ora serrata. Composed of three main types of neurons. There's photoreceptors, bipolar cells, and ganglion cells. The signal spread from photoreceptors to bipolar cells to the ganglion cells. This is actually going to be quite important. And this, because I like the tracing a path of light. You know me. Come on now. Dr. Kim loves this stuff for tests, right? Okay, so and then more things to know. Optic disc, this is where the optic nerve leaves the eye. This lacks photoreceptors, as we talked about it, and so it's referred to as the blind spot. Pretty sure that's important. The retina has 250 million photoreceptors that are one of two types, rods and cones. Rods deal with dim light and black and white vision, and so they're more sensitive to light, and cones deal with color vision. More pictures. Okay, rods deal with dim light peripheral vision receptors. They're more numerous and more sensitive to light than cones are. No color vision or sharp images, but numbers are greatest at the periphery. This is also the reason why, if you've ever gone sky stargazing, that stars in the corner of your eye actually seem a lot brighter in the night sky than the ones that you're staring directly into. And I don't know if you've ever tried this, but if you try to look directly at a bright star, the exact bright star that you were tracking in the corner of your eye, they actually tend to dim down a bit when you bring that same star into your central vision. Cones then are vision receptors for bright light and high resolution and colored vision. Macula lutea, or also known as the macula, is the area at the posterior pole of the lateral to the blind spot, contains mostly cones. Fovea centralis is a tiny pit in the center that contains all cones. So it's the region of best visual acuity. Eye movement allows us to focus on an object so that the fovea can then pick it up. Okay, so this is another pathway of light situation. These are probably important as well. like this picture. Okay, two sources of blood supply the retina. The choroid supplies the outer third, the photoreceptors, and the central artery and the vein of the retina supply the inner 2/3. They enter and exit the eye in the center of the optic nerve, and the vessels are visible in a living person. Okay, a couple things to note. Retinal detachment. It's a condition where pigmented and neural layers separate. They detach, allowing a jelly-like vitreous humor to seep between them. It can lead to permanent blindness, and it usually happens when the retina is torn during a traumatic blow to the head, or like a jerking movement, like bungee jumping, or even with like accidents, car accidents, where you get a huge whiplash. That happens a lot. That can happen. Symptoms described by a human as like a curtain being drawn across the eye. It literally feels like, oh, there's a curtain coming down and I can't see. Treatment is reattachment of the retina with laser surgery. It's kind of like when when you weld. It's kind of like that, just kind of tacking them up. Okay, which takes us to internal chambers and fluids. So the internal chambers and fluids, we're talking about the lens and the ciliary zonula separate the eye into two segments. There's the posterior and anterior segment. Okay, the posterior segment contains vitreous humor. It's a fluid that transmits light, supports posterior surface of the lens, holds the neural layer and firmly against the pigmented layer, and it contributes to intraocular pressure. Vitreous humor in the human embryo, it forms in the embryo and it lasts an entire lifetime. That's that stuff. The anterior segment, the iris divides the anterior segment into two chambers, which has the anterior chamber between the cornea and iris and the posterior chamber between the iris and the lens. The entire segment contains aqueous humor, which is a plasma-like fluid continuously formed, unlike the vitreous humor, by capillaries of the ciliary processes. It drains via sclerovenous sinus, which is the canal of Schlemm, at the sclera-cornea junction, and it supplies nutrients and oxygen mainly to the lens, but cornea, but also the retina, and removes wastes. So this is a constantly moving piece there. Okay, so here you have it. This is the aqueous formation. We should probably, these are important too. Okay, which brings us to a clinical correlate. Glaucoma is a condition in which drainage of aqueous humor is blocked. It causes fluid to back up and increases pressure within the eye. Pressure can increase to dangerous levels, and it can compress the retina and optic nerves, and that can lead to blindness. So there's few really early signs, but late signs where like you'll see halos and lights and blurred vision. It gets to be a little you get visual changes that are pretty remarkable. Detection, and you do something, it's called tonometry, where you do the puffs of air in your eye. Intraocular pressure is determined by directing a puff of air at the cornea and measuring the amount of corneal deformation. Tests should be done yearly after age 40, just to kind of keep things in check there. And the eye drops that increase the rate of aqueous humor drainage and decrease production, laser therapy and surgery are all treatment options. So we'll go ahead and move on to the next during the next segment.